Dr. Hildreth.
Ready for this
Thank
afternoon.
you, Dr. Monteau, and thank you, Dr. Gruber. When you did your risk benefit assessment in your briefing document, there were 6 scenarios that you considered. It strikes me that scenario 3, where you have the incidence from, I think it's June of 2021, where the cases are low, the hospitalizations from myocarditis actually exceeded hospitalizations from COVID-19. And as we get more adults vaccinated and we see the Delta curve waning, isn't it likely that that's going to be the more likely scenario versus the highest incident that you have in your assessment? So could you comment on that? Because to me, the single most important question is whether the risk or the benefits outweigh the risk. And in that scenario, they clearly don't. So can you comment, please?
Sure. We obviously looked across all the 6 scenarios, and you'll get a chance to hear that in some detail from the FDA's presentation. Our opinion in terms of scenario number 3 is it actually picked the lowest rate of disease, which is actually lower than what's being experienced now. And I think if you just look at our track record in terms of predicting the epidemic, we've not done particularly well. Given that the winter season is coming, the Delta virus is still out there, you still have a large number of susceptible children. There's every reason to believe that the rate will not be at the nadir. But let's suppose that it is. Even in the FDA briefing document, they talk about the fact that despite that difference where now the number of myocarditis cases may exceed the benefits seen from the vaccine, and of course in a circumstance where you're assuming that that rate is the same as in 12 to 15-year-olds, that the other benefits, and particularly those societal benefits, obviously protecting vulnerable populations and including populations of color, the ability to get children back into the schoolroom setting. I think, as you know, many children depend on schools as a safe place as well as a place to often get their meals. So all of those things, I think, have to enter into the equation regardless of the rate that's but in our view, it's more realistic to think that the rate is going to be higher than that very lowest rate that's been.
Thank you.